Okay, so now let's talk about, just for a couple of minutes, about our implant system, the implant that we're going to put in place. This is the Paltop implant system from, Paltop Advanced Dental Solutions. This is not a system that was just developed to copy other implants, but developed and designed by identifying, let's call it, the four core needs that relate to, let's call it modern implant dentistry and our needs. And what are they? Number one, aesthetics, right? Aesthetics, that's important, at least in my practice. Number two, immediate placement and loading. Number three, prevention of bone loss and peri-implantitis. Number four, it needs to be simple, not overly complex, okay? Because I'm going to show you a lot of things that seem to be complex, but again, it's all behind the scenes. You want to do simple things in your office. Okay, so aesthetics, right? How does it address that? And I'm just going to point out, some, prominent items relative to it. Not every feature. There's a concave design built into all what I will call the transgingival components. Transgingival components are what? They're healing abutments, right? They're maybe I have a slide that shows that. Healing abutments, impression copings, provisional components, peak abutments, definitive abutments. Well, why do we make that concave design and not have a straight wall design? And that's because we want to maximize the volume of soft tissue. And by minimizing that and creating something that's concave as opposed to convex, right, we're going to go ahead and have that. If any of you go ahead and do root coverage procedures, or maybe you send them to the periodontist for root coverage procedure, when they go ahead and cover that recession, right, what do they do? It's the first thing they do. They flatten the root, right? Because when it's prominent, right, or when it's convex, right, you're not going to get the soft tissue to cover it. So soft tissue likes space. It doesn't like more titanium, it likes less titanium. So a concave pattern is built into all of those areas. Now, originally, implants, if we go back to the 1980s, right, had a cylindrical straight wall design. More recently, right, they've come up with a more aggressive taper design with an aggressive thread. And the Paltop implant has the newest design. You'll see it some other companies also. And this is a design that's almost somewhat of a combination of those items, where there are three segments to the implant. There's an apical tapered portion, right, that has cutting threads on it, right, and an apical taper so that it can avoid anatomic structures. And there's easy insertion of the implant by that tapered portion. But then there's a cylindrical portion, and that gives you compressive threads and increases the stability of the implant itself. And at the most coronal portion are micro threads to distribute stress. In terms of bone loss and peri-implantitis, there's an ultra-pure surface. It's a proprietary process that Paltop uses, and it has an ultra-pure surface. I didn't list it here, but you go to the EDI journal that lists, Paltop has, if not the pure surface, the top pure surface of let's call it the top two companies in the world. And most companies have, believe it or not, impurities of other metals that you don't want in materials on the surface of the implant. Again, in terms of trying to prevent bone loss and peri-implantitis, you need a stable connection. There's let's call it a conventional hex connection that's on this with very precise measurements and machining, right? So it's a very secure connection, and there's not micro movement of that abutment, which can cause, right, bacterial leakage or fracture of a screw or loosening of those of the components. The surgical systems, in the conventional surgical systems, use a step drill format through the entire sequence of drilling. So each drill leads the next drill. And then maybe one of the most important features for me is that within the dimensions of the implant, and they're actually, I'm showing you four, but they're really five, 325 millimeter diameter, 375, 425, and there's a 6 that's not on there. The core implants of 375, 42, and 5 have the same connection. So what does that mean? Number one, in terms of, let's call it inventorying of components, impression copings, abutments, right? There's only one for all of these. But because it has a common connection, I can select the implant dimension and diameter based upon anatomical considerations and not based upon needs of emergence profile. So what does that mean? That means I can extract a maxillary central incisor, right? And let's say I'm going to place an implant and immediately provisionalize that implant, right? I want maximum stability, right? I want maximum contact with the bone. I can put a 5 millimeter diameter implant in there and not be concerned that the emergence profile is going to be way too big, right, for that implant, because the restorative component is smaller. It's the same component I'm going to use for a 3.75 millimeter dimension implant.